Hello and welcome to Aging is for Everyone. I'm Laura Mondello and I'm your host for the show. There was a time when you may have had to have the talk about the facts of life with your kids. Well, now it's time for the conversation, and that's on the other end of life. The Conversation Project is what we're going to talk about today, and I'm happy to welcome Jennifer Wood, who is the Assistant Coordinator of Neighborhood Services with the Erie County Department of Senior Services. Welcome, Jennifer.
Thank you. How are you?
Tell me first, what is it that you do at the Erie County Department of Senior Services?
I have been a case manager, and I've worked on the hotline, New York Erie County Senior Services Connects. Currently, I'm working in program development, and I work in community education, in public advocacy, with age-friendly communities, falls prevention. And one of my responsibilities is to Interim Commissioner Randy Hoke and the Advisory Board, which is a community group of citizens who are the eyes and ears of the community for the department. And that's how I first heard about the Conversation Project.
Tell us, what is the Conversation Project?
It's a project about end-of-life decisions, and it's something that was begun by Ellen Goodman, who was an award-winning columnist, and she lost her mother early and after a long illness, and wished she had had more information and wished they had had the conversation about her wishes before she died. So she began this project. So as far as the Conversation Project, it's basically a web-based program? It is. It's a lot about social media and the internet. One of the biggest things is the website, and you can go on it just to check it out and see if it's of interest to you. And you can actually fill out some questions. It's in a starter kit. Gives you an idea of the kinds of questions that you might be thinking about before you have the conversation and what your conversation might be about. And it's really about 12 pages of just thought-provoking questions. Some of them are on a scale of 1 to 5. Do you want more information, or do you want less information? Do you want your doctor to make all the decisions, or do you want to be in on every decision? And what are the 3 most important things that you want family and friends to know? And so this conversation can really take place anytime, at any age, and really throughout a period of time when you're beginning to put your healthcare proxy together and all those other things.
So for instance, if a family, is thinking, mom's getting older, or mom's thinking, I'm getting older, what do I want? And often it might come up when somebody has had a situation in their family where maybe somebody had issues come up that they didn't know what the person wanted. So this project helps walk them through.
Very much so. Well, especially since we've all become slightly comfortable with filling out healthcare proxy, and we kind of think, okay, I've done it. And this is about more than that, because today our lives are longer and fuller, and we're healthier, and we don't just keel over, and we usually most people have many years with maybe 1 or more chronic diseases, and so life is spread out. There's great health care, and so we need to maybe do a little bit more than the healthcare proxy. Talk about what's important to each of us, and what's most important, and what we want, and what we don't want.
So it's really, it's almost like defining your values and what you personally value at the end of life. How you want, do you want to be in a hospital? Do you want to be at home? Do you want...
And Ellen Goodman says herself, she and her mother were very close, and they talked about everything, but they did not talk about her wishes. And
it never occurred to them. And her mother once said to her, after visiting a friend, if I'm ever plugged up to one of those things, unplug it. And Ellen said, this was just a few years ago, and there was no plug. So she just felt so helpless in making all these decisions. And there are a lot of decisions to be made, you know, feeding tubes and intubation, and, you know, it's not a simple black and white anymore. So it's really something you have to think about. It's very personal. It's very much about whether you want your friends around or you want your clergy person around, how much personal care and touching and that sort of thing. It's just very, very much something, and it takes some time. It's not, it's not quick.
Right, right. It can, and the whole idea behind this is that it walks you through the process and gives you the questions to think about. So it's not something that you have to sit down on, you know, Monday night and decide by Tuesday night, here's my conversation, I'm done, let's have it on Friday. You know, you can kind of go back to it and work with it.
And in fact, I went to the website, and it took me a few times of going to the website to really zero in on it, and then I opened the starter kit, which they have, this wonderful starter kit, and then I went back and you know, sort of, it took me a few times, and then I printed it, and then I read the questions, and so it is very much a process.
And then once, you know, I think that because, like you said, some people just have their healthcare proxy and they think I've already done it, but this really goes much deeper and is a way to help you identify yourself what it is you want, and that way you can communicate it to your family.
Yes.
So they're not in that situation of Ellen Goodman.
Exactly.
What would my mother have wanted?
Exactly. And it's really it's a gift for your children. It's a gift for your family, because you're not leaving them to have to make these decisions. And and you've done the work, and all they have to do is to follow the follow the guidelines that you set down, and you can just hand these little starter kits to them. So it really is, it's wonderful. And And then hopefully you have the same discussion with your doctor, your personal physician afterwards.
Right. So folks can go to the website.
Folks can go to the website, and there's a starter kit, and then it also has many wonderful stories. And you can also put your story on the website yourself, and it has also a starter kit for working with your physician. But I know they've done so much work to get so many wonderful stories from across the country.
Wonderful.
It's terrific.
Great. Well, thanks for telling us about the Conversation Project.
You're welcome. Thank you, Laura.
We'll be right back with more Aging is for Everyone.